Welcome to Advancing Evidence-Based Decision-Making for COVID-19, a Johns Hopkins-based interdisciplinary Zoom webinar series. Our goal is to provide an interdisciplinary forum to advance evidence-based decision-making for COVID-19 and future pandemics. To make this truly interdisciplinary, it has been a cooperative effort to get this webinar series off the ground as we aim to engage not only economists and epidemiologists, but biostatistics, ethics, system science, really anyone seeking to learn more about emerging models to inform COVID-19 decision-making. Special thanks to Kate Grabowski, co-organizer of the webinar series. Also, thank you to Liz Stewart, Mario Masis, Marcelo Ariel Fernandez. Reflecting the interdisciplinary nature, many organizations here at Hopkins have been involved with the organization and facilitation of the webinar series. I'd like to call out the Johns Hopkins University COVID-19 Modeling and Policy Hub, the Hopkins Business of Health Initiative, the Infectious Disease Dynamics Group, the Department of Economics, Department of Epidemiology and Health Policy Management, School of Public Health, the Carey Business School, the Alliance for a Healthier World, and the Bloomberg American Health Initiative Evidence Work Group. Okay, with that, it's time to transition to today's webinar. Economists and epidemiologists not at odds, but in agreement. We aim to have a conversation about the areas where evidence-based decision-making for COVID-19 and other epidemics could be best advanced through multidisciplinary collaboration. This is a webinar with nearly 500 participants. Discussion from our audience will largely be conducted via the Q&A feature in Zoom. We encourage you all to post questions and engage with this feature. First 30 or minutes or so will be a conversation with our speakers. During the second half, we will read questions in the Q&A directed to our speakers for them to respond. Again, this webinar is intended to explore areas where collaboration between disciplines can advance modeling and evidence for decision-making in ways that can't be fully realized when working within a single discipline. Please do post questions and engage with this Q&A feature. I'm Dan Polsky, the moderator today. I'm the Bloomberg Distinguished Professor of Health Policy and Economics at Johns Hopkins University, at both Carey Business School and the Department of Health Policy Management at the Bloomberg School of Public Health. I direct the Hopkins Business of Health Initiative. This is a new collaborative initiative between the Business School, School of Public Health, School of Nursing, and School of Medicine, focused on improving health systems through research on the business of health. Our very distinguished speakers are Nick Papageorge, Associate Professor of Economics from the Krieger School of Arts and Sciences, and David Dowdy, Associate Professor of Epidemiology in the Bloomberg School of Public Health. So let's turn things over to our speakers. Please tell me about yourselves, your experience, and the lens through which you're viewing the pandemic. Let's start with you, David.
Great, thanks, Dan. Thanks to the organizers for this webinar. Really excited to be here. In the interest of time, we'll just get right to it. So my name is David Dowdy. As Dan mentioned, I'm in the Department of Epidemiology, and I'm trained as an infectious disease epidemiologist. So I think about how epidemics of infectious disease course through populations. For fairness, I'm trained as a TB epidemiologist primarily. A shameless plug for TB is that TB is probably going to kill as many people today as COVID-19 will, but I still think about how epidemics course through populations. And so in doing this, my primary focus is on health. I don't think as much about the repercussions of pandemics on the economy, for example. When I think about this epidemic, the sorts of things that keep me up at night are like the following. So I'm going to share my screen. Hopefully you guys can see this, but what I've shown here is just a screenshot of the Hopkins Coronavirus Map, thanks to Lauren Gardner and her team at CSSE. And as of yesterday, there were 328,000 deaths that were recorded as being due to COVID-19. What I think about is probably, if you made me guess, maybe 2% of the entire world's population has been infected by this time. So if we let this epidemic run its course, that tens of millions of deaths are possible. We could wipe out the entire population of Maryland twice over if we just let this epidemic run its course. and that this can happen, as we know, explosively over just a few months. And so when I look at the pandemic, I'm worried about how do we prevent this from happening. And so that's where my laser focus is. And I look forward to hearing Nick's perspective on this as well.
Should I just go, Dan?
Yes.
All right.
You next, sorry.
So I think, well, first of all, hi, thanks for being here. And my name is Nick Papageorge. Before I say anything, I'm going to say that what David said also concerns me as an economist. But I think maybe the perspective I'm taking is slightly different. So I'm an economist. I am what's called an applied micro economist. That means I work with data. That's the applied part. And the micro part means that I'm on the side of the hallway where we think about individual behavior decision making. So on the other side of the hallway are like the macro economists who think about the global economy, things like trade, central banks, economic growth. And we do talk to each other from a safe distance. And I bring macro folks up early on because I think they are also going to play a role in how we should be thinking about the pandemic and its consequences. So as a microeconomist, I am, of course, interested in boilerplate economic issues like income and wealth inequality, unemployment, skill acquisition, education, and so on. But economics is ultimately a social science, so I, along with many other people, try to understand behavior in all sorts of domains, including health-related behaviors. So the lens through which I view the COVID epidemic is rooted in the idea that it is really difficult to design good policies without first understanding how people make decisions. So in the current crisis, we might want to understand what are the circumstances, context and constraints that determine whether or not people take self-protective measures like social distancing. My experience in this area actually doesn't come from TB, it comes from HIV. I used to, or I continue to, but I've written on HIV. For example, I showed in one paper that people with HIV, who are HIV positive, often don't take life-saving drugs because of side effects, and not only because side effects are painful or uncomfortable, but because they make working difficult. And in a current project, my team and I are showing that this dynamic is even more pronounced for people with low education. So they may have jobs that are less flexible, more physical, they may lack benefits, sick leave, financial cushions. And I think there are clear parallels to what we're seeing today. Social distancing is irritating for a lot of us, but devastating for people who need to work, don't have a comfortable home, people who are stuck at home in a high stress situation with someone who is abusive, and so on. So why might this lens be helpful? The aim is not to say, okay, people are rationally choosing not to socially distance, so let's all go home. Describing behavior is not endorsing it, certainly not from a public health or an economic or societal perspective. The aim is to design policy to achieve goals, for example, encouraging people to engage in behaviors that slow the spread of illness. But to achieve that, we need to design policy that is humane in the sense that it meets people where they are, take explicit account of the pressures that they're facing, their circumstances. My own initial efforts here have been basically an attempt to try to understand people's behavior. So I've engaged in several efforts to collect data, to understand what factors seem to associate with self-protective measures like social distancing. So I can talk a little bit more about that later on. But just to sort of finish up, ultimately we want to design policies without destroying people's lives. So we want to design policies that take behavior into account, but we also don't want to destroy people's lives by decimating the economy. And as the economists in the room, perhaps you thought that would be the first thing I would say, but I wanted to start with the behavioral angle. But there's also the economic angle. A catastrophic economic downturn not only ruins lives through lost savings or shuttered businesses, but poverty also leads to a host of very costly social ills like addiction, abuse, education gaps, mental health problems, and even death. So if we care about inequality, this crisis gets really tricky. The spread of illness is costly and also affects people differently. Social distancing places an uneven burden across households. And an economic downturn would hurt most everyone, but especially those who are economically vulnerable already.
Thank you. It's so helpful to hear, from both of your perspectives. And, I think it's notable that, it's quite different than the rhetoric that I think is out there in the general public among those that are, so affected by the consequences of the epidemic that really, seems to represent these extremes of, the epidemiologists are all about containing the spread. The economists are about get the economy back. But, it doesn't seem to represent the approaches as there's a common desire to mitigate the consequences of the epidemic. And there's an understanding that, we just can't open the economy. We can't just keep things shut down. So in moving forward as a way to establish the unique approaches of each discipline and anchor our conversation, could each of you describe in general terms for our general audience of scientists what models in your field are trying to accomplish and how this is being applied to the COVID pandemic? And if you have some visuals, please use the share screen feature. Again, let's start with you, David.
Perfect. So first, also just to say, I couldn't agree more with Nick and the focus on disparities and the fact that this pandemic can certainly exacerbate a lot of the disparities and inequalities that already exist in our society. I will say, just to be a little bit on the provocative side, that I'm not convinced that that every economic downturn has adverse health consequences. I think that we've seen in the past that, like for example, the recession in the U.S. Was not necessarily associated with any increase in mortality, and maybe there was a small increase in suicide. But the amount of all-cause mortality that has already been reached by this pandemic dwarfs those numbers. But it's also hard to learn from the past, where most of the recessions and small ups and downs of the economy are nothing like what we're facing today. So in terms of how we as epidemiologists think of the pandemic and the tools that we use, often what you'll see, and there are many epidemiological tools, but often what you'll see are mechanistic, so-called mechanistic models of infectious disease transmission. And I will put up a single visual again so that you guys can see what I'm talking about. So what we do in the most classic sense is separate the population according to their disease state. So these so-called SEIR models, for example. So you take a population and you see what fraction of them are susceptible to the disease, what fraction are exposed, what fraction are currently infectious, what fraction have recovered over time. And we can use these sorts of models to get a sense, for example, of quantities like the reproductive number, or R. So what the reproductive number is an estimate of, for every person who has disease, infectious disease, how many secondary cases that person will generate before they finish their infectious course, whether because they're cured or because they die. And this is important because different levels of this reproductive number can imply different disease trajectories. So for example, I've pulled up a couple of simulations, just web-based simulations using this framework, and plugged in after an intervention such as a lockdown. If what this does generates an R of 0.95, so just below that epidemic threshold, and sorry, there seems to be some drilling next door here, you can see a very slow decline in the epidemic. Whereas if these measures get us to an R of 0.55, for example, we see much more rapid decline. And if we know what we're looking at here in terms of the epidemic spread, then we can plan accordingly. And so these are the sorts of tools that we as infectious disease epidemiologists are used to seeing, used to using. I think what everyone wants from us are forecasts of what's going to happen in the future, right? But those are very difficult to generate because there are a lot of uncertainties. For example, we don't know how much of an effect warmer weather is going to have. We don't know how people are going to respond to different policy decisions that are made. And so it's very difficult for us to project what's going to happen months and months into the future. But these are the sorts of things that we use to try and understand where the epidemic is and where we might be going.
Over to you, Nick.
Yeah, so there are many different kinds of economic models with all sorts of purposes. So I need to be a little cautious here. So I study individual dynamic decision making, which means I try to build models that capture how people weigh the costs and the benefits, both now and in the future, of their behavior. So the first thing we do is we envision people as making the best decision they can, given the constraints and circumstances that they face. This is kind of like the often misunderstood rationality assumption that people are doing the best they can, given the circumstances they face. We don't see people as robots that know everything. We just think people are trying to be as well off as possible. But that might include doing things that we would rather they not do from a public health or from a societal perspective, like working even though they've been exposed to a virus because they need money or can't telework. Or it might be that they're just ignoring advice to socially distance because they don't think social distancing is that effective. Or maybe they just believe that the virus isn't that dangerous to them, either rightly or wrongly. I mean, there's a whole literature about how people form their beliefs and how these beliefs might be wrong. So once we've built some kind of a credible model of behavior, the next step is to understand, okay, but what are the societal goals here? And are these misaligned to what individuals are choosing? And if so, again, the answer is not to say, oh, well, they're rational, let's go home. The answer is to say, okay, given what I've learned about human behavior in this context, what are the policies I can think about that might align people's incentives to help us achieve social goals? So for example, if the need to work and earn a living prevents social distancing, what can we do? And I need to, here I like to emphasize, you can't really think through these policies in an effective way without meeting people where they are, without understanding why they're making the decisions that they're making, even if they're not the decisions that we want them to be making. Now, applying this to the COVID pandemic, one of the goals that I started with is just collecting data to understand what people are doing and why. So I'm just going to show you some preliminary results. Can you see it?
Yep.
These are just really simple things. I mean, the first thing, this is data that we collected in the last week of March. And it's actually from 6 different countries, about 1,000 per country. And this is from the US. So the first thing we can find are that there are these very strong income relationships. So these are income quintiles, representative of the US. And then this is the probability of engaging in one of these kinds of self-protecting behaviors. There's the red one is just, did you change any behavior at all in order to self-protect given the pandemic? And you see that there's this kind of clear rise. We also looked at hand washing or mask wearing, same thing. And then you can also look at social distancing behavior, like not visiting your friends and relatives and whatnot. And these are pretty big differences, right? I mean, you're going from something like 30% to 50% as you move up. So this is not trivial. The other thing you can see in these data is that the burden of the early consequences of the pandemic is not equal. So if you just look at lost income, the share of people who report that they've already lost income falls with income. So it's the people who are in the lowest income quintiles that are losing income. Part of the reason might be because people who can work from home quite well, that green line, tend to be people who are high income, probably because they're in a professional job where they can do everything remotely. this is just to kind of show, like, if you want to understand behavior, you can't just sort of look at a couple of things. We find that gender, region, pre-existing health conditions, access to open air at your house, income losses, beliefs about the effectiveness of social distancing. These are all going to correlate with whether or not you're going to socially distance. And just to put a little more nuance on it, because this is what you can do with microdata, this is a question about beliefs of how many people are infected in your area. And you'll notice that we cover 0 to 100. So there are people who actually think that 100% of people in their area are infected. And one of the kind of bizarre things we found is that if you say something sort of reasonable, like 0 to 15 to 20%, that correlates with taking more self-protective behaviors. That makes sense. But it seems that as you get towards the sort of less reasonable answers, this could either mean that people don't understand probabilities, and it could also mean that they really believe that almost everyone's infected, and they become fatalistic because they say, well, what's the point? I'm going to get it anyways. Why should I bother taking self-protective behaviors? So all of this is really just to illustrate that this is a very complex set of decisions that we need to understand if we want to make sense of how to get people to do the sorts of things that we feel like we need them to do. And then beyond that, it gets even more complicated because there's this interplay between individual behavior and what happens on the aggregate level. So both to the economy and the spread of illness. Again, the big picture here is that we want to design policy that takes individual behavior, circumstances, beliefs, et cetera, into account. We want to reduce the spread of infection. We want to do that without destroying people's lives by decimating the economy. And that requires us to understand which policies are most effective given what we learn about how people are making their choices. I think I'll end by saying, the outside space finding that's very robust in our data, that people who have outside space in their house are more likely to socially distance. I mean, I think, it might sound a little silly, it's a cute finding, but it's also maybe important because you start to think like, well, maybe in low-income neighborhoods with cramped housing, it would behoove us to figure out how to get people outdoors in a safe way, because that could then prevent some of the downstream costs of social distancing, such as violence and abuse. It can encourage social distancing by making it less painful and costly to the individual. And that in turn could slow down the spread of the illness and allow us to reopen more quickly. So this is why you want this microdata and why you want to understand decision-making, because it can help us to think about policies that would be useful.
So thank you. I think now that you've spoken to what your field and the approaches can offer, I want you to take a bit of a critical eye to the models that get produced kind of within your discipline, and offer some thoughts on what's in effect crossing the aisle or working with experts from the other discipline or another discipline could contribute to addressing some of the limitations of the models that exist within your field. Particularly thinking about the understanding the consequences of specific policy levers that are emerging during this pandemic. Again, we'll start with you, David.
All right, great, thanks. And I mean, I think in terms of some of the limitations of epidemiological models, Nick has really hit the nail on the head. So what I think that epidemiologic models do well in general is to estimate what's going to happen at the population level, right? So to get a sense of how many cases of illness have we had, how many deaths might we have under different assumptions, under different scenarios, right? But what we often don't do well is to capture some of the nuance of some of these some of these considerations about behavior, et cetera, that Nick has highlighted. So in general, the epidemiologic models that do the best in terms of fitting the observed data at the population level on epidemic curves, for example, tend to be the ones that are the simplest, right? So the CDC, for example, has commissioned a group of modelers headed by Nick Reich up at Massachusetts to project or forecast the number of deaths in the coming week or 2 weeks, et cetera, right? And many of the models that perform the best in those sorts of forecasts are the simplest ones, right? And what these epidemiological models often do in terms of estimating the impact of policy options is very crude. So, for example, down here in the lower left is a diagram from the Financial Times that just has it's a 0 to 100 scale of how stringent the response is. We're not thinking about specific populations. We're just thinking, where are you on the spectrum? And similarly, up here in the upper right is a model from the Imperial Group where they just considered at what point in time did different countries in Europe implement different measures, whether it's social distancing or closing public schools, etc. And they just counted up the number of measures and the dates at which those measures were implemented and looked to see what the impact would be of implementing more or fewer measures on the reproductive number of the virus. And so what we often lack in our epidemiologic models is some of this nuance so for example, should we be targeting policy towards people who don't have open space or towards people who have to work, etc., and how do we do that? Now, I want to be fair to my discipline in that I think many people are thinking about these things, but the data to inform how specific policies would affect some of these underlying epidemiologic parameters is completely lacking, right? So I think the sorts of survey data that Nick has presented is really helpful in terms of building insight, right? But what we're still lacking is an idea of, well, if we were to, let's say, screen everyone who had to work in an essential position every week, right? How much would that actually reduce transmission at the population level? And those data are often lacking, so we're left with making assumptions that nobody really knows the answer to. And so that's where I think that we are falling short, but I don't want to pose it as a fundamental flaw of epidemiologic models, but rather just an absence of the data that we need.
Nick?
Yeah, thanks, David. I think that, so if I'm going to talk about shortcomings or limitations, I should preface this by saying that there are so many ongoing efforts by all sorts of great scholars to work on this kind of problem. So I might be like missing things that are going on given the speed at which it's happening. I should mention that something like economic epidemiology has been around for some time. Models have been written down that try to integrate optimal individual decision-making into sort of simple, these SIR types of models. And there has been a proliferation of these models in recent weeks, and I don't think that's a bad thing. I think economists attempting to incorporate policy and behavior change into epi models is exactly where we should be going. But here are maybe a few, thoughts. So one concern I have is that a rich economic model behavior with a very simple SIR kind of component may not be satisfying to epidemiologists. I've heard a lot of people say, we incorporate an epi model, and I can kind of see the epi people cringing, saying that's like an epi model from 400 years ago. That's absolutely not what we would do. Epi folks are building up these extremely sophisticated models that are very useful for forecasting disease spread, far better than like a simple SIR model. In economic models, much of the machinery is dedicated to understanding the behavior side of things, as I've been saying. So because, and I've said, because we're incorporating these behavior changes, maybe that's useful for policy analysis, but it might not be kind of capturing the spread of illness in a reasonable way. Now, a second concern I have is that if we add more to the disease spread part of the model, the behavior part of the model needs to be simplified. And so I've noticed that some of the econ models, and I'm not saying like there's something wrong with them, I'm just saying there might be limitations, and this is why we need many models and more collaboration. Maybe you're just looking at young versus old people, or maybe you're looking at two different industries, one that's high risk, one that's low risk, but you're vastly simplifying things, and you're certainly not taking into account, say, beliefs about disease spread and whether or not you have outside space at your house, because those are these like tiny little details that make things very nuanced, but that might be very important. Finally, I think that I would like to see models that also take better account of the downstream effects of things like social distancing, and that could therefore capture some of the trade-offs between working and staying at home given income inequality. Like that is sort of missing from a lot of the models that I've seen. And again, like there might be like that model might exist somewhere because someone wrote it like over the weekend. I've written one that I haven't estimated yet and that I'm working on. So look, my starting point as a microeconomist is to look at the individual. I like getting as many variables as I can together to see why people are doing what they're doing. But the question becomes like, okay, great, but how do we put this together with a credible model of disease spread that won't make an epidemiologist queasy?
I think we're heading in that direction, and this is the final question. So please, if you have, we're gonna hopefully have a lot of time for discussion. So let's keep that maybe this last question brief so we can move to the Q&A. But please avail yourself, for everyone in the audience, to engaging with the Q&A feature. So the last question is really, I've just tried to be a little more specific. I think we're just heading in that direction, which is a little bit of an agenda for collaboration moving forward. I think you've both mentioned a lot of areas of opportunity, but I guess maybe, is there one in particular, or how would, like a concrete sense of an agenda where collaboration might add value to what we see ahead in terms of using models to inform decision-making within this pandemic? Repetitive here, but just we'll again start with David, just to so we don't hear from the same from Nick, at the same time. So David, to you.
All right, Nick always gets the final word. That's probably the best, anyhow. So I will once again, I will make this brief, right? And so
and can you use the screen share feature?
I'm going to try to. Okay. Yeah. There, is that better?
Yeah.
So I'm going to put two ideas out there, right? The first, I would love to see more models that include in some fashion both the loss of health that's due to COVID-19 itself and the loss of health that's due to the response. So for example, over here, if on the y-axis we have loss of health and on the x-axis we have the number of deaths or the size of the epidemic, right? The larger the epidemic gets, right, the more health losses we have, right? But if we are having a larger epidemic because we are able to open up our economy, right, then as the epidemic is larger, we may have fewer deaths due to the response. So thinking about how do we combine these two, and not only that, but how do we improve our response so that we have fewer deaths or Dowdys or whatever it is, more people, happier people over the course of the pandemic, and to consider both of these in the same framework. And then the second request is to start to develop models that can evaluate specific both economic and public health policies that can maximize increases in our economic activity while minimizing the corresponding increases in transmission, right? So if we have the transmission on the y-axis and the economic activity on the x-axis, this doesn't have to be a linear increase. As we open up, we get corresponding increase in transmission. So are there smart policies that we can institute that will allow us to increase our economic activity without a major increase in risk of disease spread? And I think both of these questions are critical, and neither can be answered by an epidemiologist or an economist alone.
Thank you, that was great. Nick?
Yeah, that was great. I wholeheartedly agree. I'll just say a couple of things here. Look, I don't really care about social distancing. I don't think anyone does. I think what we care about is the set of policies that we have available to us. I don't know, like food stamps, and then like disease spread. Now, the mechanism through which one can affect the other is maybe social distancing. People can stay home more if you provide them with unemployment insurance or maybe increase their SNAP benefits. And that's what we ultimately want to understand. You know, my models can tell you something about behavior as it relates to unemployment benefits, and an epi model can tell you something about how behavior will relate to disease spread. But ultimately, we want to put these things together because we want to know what policies slow disease spread, but do so in a not so painful way, or in the least painful way possible, which is exactly what David said. I would say that, and this is more big picture, so it's not super specific, but my concern is that if I'm trying to put an epi component into one of my models, I'm doing it sort of on my own, and I'm making my own choices or with other economists, you know, about what parts to strip down of the model. And because we're siloed off, that seems like the right thing to do. I mean, in our kind of like academic disciplines. I think the current crisis represents a tremendous opportunity to collaborate. And I think some of the barriers between the disciplines are coming down, and that's fantastic. And I hope it sticks. Because what should really be happening is epi people and economists should get together and basically figure out how to compromise. What is it that I'm willing to give up in my fancy, computationally burdensome dynamic choice model that I can live with? And what is it that the epi folks are willing to give up and still say that I have a credible, that we have a credible model of disease spread? Because that's the only way this is going to work. And I don't think we've been doing it enough. And I think that that's how we're going to build like a model that can help us not only understand the current crisis, but start to prepare for the next one.
That's great. You know, compromise is needed, and I think that within a discipline, it can be difficult when you're looking for promotion and getting in the fancy journals, because often the compromises are what gets you dinged by the reviewers. So I think a crisis like this, where we're really focused on how we can help, offers real opportunity for compromise that doesn't exist when you're, you know, focused on career advancement. So I think that's a really important point. So we're going to move to the Q&A portion here. That was really terrific, David and Nick. I'm going to turn it over to our co-organizers, Kate and Mario, who've been manning the question and answer feature, and we'll kind of select some questions to point to our panelists. So Kate, you first.
Yeah, thank you. This is a really wonderful discussion. There's a lot of rich questions in the chat and in the Q&A. So let me just start at the top with Amrita's question. She says, given the need for real-time decision-making that has been needed in the COVID response, how would you suggest weighing the public health consequences against the economic ones? What might we learn going forward in terms of concrete strategies? So I guess there's going to be two sets of consequences, right? There's going to be economic ones, and there's going to be health consequences. And how do we ultimately decide what's worse?
And I'll just say, I might cut you guys off from long answers. There's a lot of questions, so maybe try to, and for the purpose of getting through questions, I know you'd like to give complete answers, but try to keep it efficient. David?
Yeah, we can also bounce back and forth so that we don't both answer each question. I'll also say to anyone who doesn't get your answers, doesn't get your questions answered here, please follow up with me or Nick by email. I'd be happy to answer additional questions. But I think Amrita already mentioned that I've answered this a little bit. I think we just need a common language, right? And whether that language is health or some way of balancing these two. I think that we need to have, and as Nick has kind of mentioned, the epidemiologists and the economists agree that there's going to be this common language, and that we're going to have to make these trade-offs and what those trade-offs should be.
Yeah, I agree with what David says. I would just add that social scientists, because we study human behavior, could have predicted that social distancing would be really hard for low-income people. I got some data to verify it, but I already knew that was going to be the case. So I think that it's important to bring epi and econ or social scientists together to figure out where the hotspots are going to be, who's going to be most vulnerable, who's going to be least able to do these things. Because understanding who they are not only can increase public health, but also can reduce the economic consequences.
Thanks, Nick. Mario, you two have been manning the Q&A feature. Do you want to call out a question?
Yes, there are many. I'll start with this one by Luis Quintero. So Luis says, one of the challenges that economists try to address are out-of-sample forecasts. How can we know how people will behave in situations that have not happened? And so are structural models from economics something that, or other types of models from econ, something that epidemiological models attempt to address as well?
Nick, do you want to start with this, or do you want me to? I can say that I think that there are epidemiological models out there that attempt to address some of these structural considerations. However, as I mentioned before, the data at a population level are very sparse and challenging. And so since most epidemiologic models look at the world from a population level perspective, it's often difficult to get the data that we need to inform those sorts of parameters, but the structure can be implemented, and I think many people have tried to.
Yeah, I think I agree with this point. I mean, I think this is exactly, Luis, I think this is exactly where economics has a big role to play, because this is exactly what we do. And I think exactly this is what I think is missing from some of the epi models that I've seen. That's why we need to collaborate.
Kate, next question.
Yeah, I'm scrolling through here and trying to get at something we haven't discussed. One of the issues I think a lot of people are thinking about is schools. And there's a discussion here about UNC opening up in the fall. We're also having similar discussions about what to do in the fall here at Hopkins. And Danielle raises the concern that this could cause a rise in COVID-19 cases. Most of the data we currently have on COVID-19, it looks at adolescent spread within homes because we're at home right now and not in school settings. And she's wondering what your opinion is on the school reopenings, and are we missing the data required to truly assess this risk? I just want to add on to this question myself, is that a lot of people are thinking about what the potential long-term consequences are for children for staying at home. And this goes for the same for pretty much all health outcomes. Like, how do we assess? David, you mentioned that there wasn't really a rise in mortality associated with the recent Great Recession, but I wonder if we haven't seen the long-term consequences of the Great Recession yet. And I'm wondering, how all these long-term potential health consequences, particularly for youth, weigh into our decisions on whether or not to reopen schools. So thank you, Danielle, for that question. And I'll leave you with this very difficult question now to answer.
Yeah, much easier to ask than to answer, I can tell, Kate. But yes, Danielle, I think this is a great question. I mean, I think that we do probably have some data on disease spread from other respiratory pathogens. So, for example, influenza, that we could probably bring to bear on the epi side of this, right? Now, what we have never seen, at least in the era of having good data, are complete school closures and then complete school reopenings, the way that we're going to see with this pandemic. So you'd have to take that with a grain of salt. But we probably do have some data that could inform the amount of transmission that occurs within schools or among these populations, again, for other pathogens. Now, I think the overlay that Kate is talking about, where we think about not only spread of the virus, but the consequences of staying home, I think this gets more into Nick's realm as well. I mean, it's not economic per se right now, but it could very well be a long-term economic consequence and a long-term epidemiologic consequence, and figuring out how to balance those out, as well as the uncertainties that we have in both of those data, I think is challenging. I wish I had a better answer.
Oh, I wish I had a better answer too. But again, I agree with everything David says. But David said in earlier, on what keeps him up at night. I guess lots of things keep me up at night. But what I worry about are especially low-income kids who don't have a comfortable house or good internet connection, for whom the school year effectively ended in March. Who are going to fall behind their peers. I worry about the hundreds of thousands of cases, if I read the article correctly, that came out recently, of unreported child abuse cases. And these things have very, very, very long run consequences. These are things that are going to bite us in the rear like 20 years from now, these kinds of education gaps. And we already know that low income people have these very unstable education trajectories. So I imagine people who are, going to community college, or we're going to community college, and we're just barely kind of hanging on as it was. And then this just kind of ends that path and they never resume it. I mean, that's hugely problematic, because that's going to affect their productivity, their employment, their children's outcomes, and so forth. So that's what keeps me up at night. And I don't know what the right answer is.
I'll just add that, I think we're in this webinar, we're coming up with quite an agenda for future research. And I know there's a lot of junior people or aspiring modelers, or those with models that are looking to answer emerging questions. I think there's an agenda that's kind of emerging from this webinar, and there's an opportunity to connect with people from another discipline, because there's a lot of people on this on this webinar that, are looking to connect. So if you have a need, you could just throw it into the chat or the Q&A and see if there can be some matchmaking that can come from this, as a lot of our answers are, to be determined, or we're not sure yet. Gives a lot of opportunity for future work. So just a little plug there to engage and make some matches. So I'm going to turn the next question to Mario to call out.
Okay, so Joshua Mack asks a short but really important and difficult question. So to what extent do policymakers react to economic projections relative to epidemiological data? And I will add just briefly that we know that economists and epidemiologists are talking to each other in a constructive way. But I wonder whether the public is perceiving that these two positions being at odds with each other. So I'd love to hear what David and Nick have to say about how policymakers are reacting to economic data and suggestions, and epidemiological data and suggestions, and whether they think there's an optimal way to integrate for them to integrate the two to inform policy making.
Yeah, well, great question, Joshua. And I think the ideal, of course, right, is that the policymakers, the epidemiologists, and the economists all have long-standing relationships with each other and mutually respectful relationships with each other, to where you can have a reasonable discussion where you balance some of the public health considerations against the economic ones, and come up with solutions that are the least bad for both, right? Now, I would say, unfortunately, in the current political climate, what often is seen is we see polarization in every aspect of politics, right? And that has included, I think, polarizing in many cases the health versus the economy. I do think, though, that it's important for us to know fundamentally that we're all on the same team here, and also to be able to anticipate that some of this polarization is going to happen, right? So we can expect that certain members of the political realm are going to take certain positions. And so can we anticipate what those are going to be and find ways within that entire sphere of creating policy that perhaps bridges some of these gaps? And where we can't do it, we find other ways at lower levels to do so. And even things like this webinar, I think, are a positive step in that direction.
Yeah, I hope that the lowering of the barriers between the disciplines persists. And I hope that, if there's a kind of a crisis response team, that there are social scientists and epidemiologists and sociologists and political scientists and medical doctors in the room, recognizing that there are a lot of trade-offs that we're going to have to face, and that we're going to have to balance different needs, because that's the only way we move forward. The rhetoric from the extremes is never helpful, and I don't think there are many people who really are at those extremes. They just get a lot of airtime, and that's not helpful.
Kate, we'll turn it to you. We probably have time for like 2 or 3 more questions. I see that there are 26 questions in the thing, so you guys are busy scrolling through them. But you can keep the questions coming. We're going to give David and Nick some homework to answer all these questions, or at least put some type of summary online along with the video. So, hopefully you will have a chance to get your question addressed at some point, even if we can't do it during this webinar. Kate?
I think a lot of there were some questions of the same flavor that I think were just answered. So I think we're doing okay.
Okay, good.
So, which is good. There was one question about taking the results from both economic and infectious disease models in countries like the United States and Europe and even China, and extrapolating those to lower income settings, such as in Africa, where the trade-offs may be very, very different. Can you talk a little bit about how we should approach modeling really from the perspective of countries that aren't as financially well off as maybe ourselves or Europe?
Yeah, well, this could be an entire discussion for an hour as well. But I mean, I think what's been unfortunate is that many countries have looked to Europe and North America for their responses, and whatever we do, they follow, even if that's not necessarily the right response for them. So I think critical to all of this is building in-country capacity to build these sorts of models, come to policymakers and say, well, what's right for the US and what's right for Italy and Spain may not be right for Uganda or for Bangladesh or what have you. But I do think that we need to be aware of the different epidemiological and economic considerations in these countries. Clearly, the epidemic has affected different parts of the world in very different ways, epidemiologically, and yet we're all locked down, or most of us are, and we're seeing a very severe economic hit across the board. And so I do think it's important for us to be considering this not as a one-size-fits-all approach that's going to work everywhere, but really considering the unique epidemiologic and economic context of each of these places and each of the policy levers that might be available.
Yeah, I don't know. I don't study other countries very much, especially in my health work. I've mostly looked at the US, so I don't have too much to say. The only thing that I worry about, or what I worry about is, again, what I've been kind of repeating over and over again, is that people who have lots of other pressures, who need to put food on the table, are going to take fewer self-protective measures. If you extrapolate that to an entire population where most people in a country are low income, I think that you're going to find fewer and fewer people able to stay home. And that is, well, that keeps me up at night, and it probably keeps David up at night too, because there's an epidemiological consequence to that. So I think it's rather terrifying.
Yeah, and those consequences are very severe in some of these other places.
Mario, this might be our last question to you.
Okay, I'll try to, okay, so condense this one by very good question by Brendan Rabideau. So both Nick and David have underscored the importance of detailed data in their models. What is their wish list data that they would ask from policymaker if cost from collecting data was no object? And quickly, a second one that's not unrelated. Is there any existing literature where microeconomic models determine the parameters that govern epidemiological dynamics in epidemiological models? This is from Elena Goicoechea.
All right, wow. So, what I would say in this regard is for us to first think about what are the actual policy levers that are likely to be implemented or not. And then to start to collect some of the sorts of data that Nick is describing. So what are the likely responses to some of these policy levers? And then how do those scale at a population level? So not just among like a survey of a few people, but across entire populations. Now, it's not just money that's the limiting factor, it's time, right? And so it's great for me to say this, but we all recognize that the policy is often made in a very short time frame. And so this may not be feasible in most settings, but that would be the ideal, at least from my perspective.
Sorry. Yeah, I think the ideal data that was what I collected like a few weeks ago, and then like the day after we sent off the survey, there were 15 things that I wanted to switch out. So I don't know if it's useful to say what is the ideal set of variables that we need, because I don't think we know yet. I think that there's going to be a proliferation of data sets, because a lot of people are doing this. There are these firms that can sort of like sample people quickly. That's actually been very useful. But I think that there's going to be a lot of room, sort of like what has been done sometimes with HIV, to look back once this is over and think really carefully using all the data that are available about what sorts of things we should be collecting. I think part of the crisis response or preparation should be, if a new pathogen comes and a pandemic begins, what exactly is the survey we need to conduct now? And just be ready for it. Because we weren't prepared. We did this all on the fly.
So we're at the hour, and I just want to make a couple of things in our last minute. The first is a big thank you to David and Nick for this really, really amazing and engaging webinar. So thank you. Clap feature for folks. Thank you very much, and to Kate and Mario for manning the Q&A and leading the discussion. Finally, I think this discussion should continue, and we'll try to post the material from today. But also, we're experimenting with this Microsoft Teams way to continue the conversation. If you're interested in joining a Microsoft Teams, put a a thumbs up in the, with your participants or something like that. If there's a way we can capture that when this is over, so we can get you hooked up to that, or we'll find a way to invite people. We're still experimenting with that, so bear with us. But I think it'd be a great way to continue this really important conversation going forward. And the other way we hope to continue this is this has been billed as a webinar series. There will be more talks coming. I think it'll kind of move from a conversation to actually presenting papers, and then but try and present them in a shorter way as opposed to kind of a typical seminar, so that we can again have a robust discussion and keep this conversation going. So a thank you to all of our participants for engaging with us and listening. And so we hope to see you again, either on Microsoft Teams or in our next webinar. So stay tuned and stay in touch with us. So thank you very much, and have a good day, everybody. Bye-bye.
Thank you.
Thanks, everyone. And do follow up with emails if you have questions.
Absolutely. Yeah.